Welcome to the video clip on functional anatomy for technology and environmental applications for living. This particular video, we're going to be running through the functional anatomy handout, so you need to have that ready and available. You'll also see it on the clip as well, but you may want to take some notes as we go along. I'll be demonstrating to the best of my ability the different movements of the body, so to kind of give you a background. You should have had this in anatomy and physiology as well, and so this may be a review. There will also be an accompanying video clip that I will have up in Blackboard that will also assist in your review. Alright, so let's get started. So let's talk about the handout at the top. And it says all body movements are referred to as a standardized starting body position. And this is considered anatomical position. So anatomical position on the sheet, as you can see it, where the lower extremities are straight and parallel to each other, and then you will have external rotation of the shoulders with the thumbs pointed outward. So that would be considered anatomical position, and I'm demonstrating that right now. So the importance of knowing that is when people are talking or you're reading a report, you'll realize that this is the beginning point where you talk about all of the movements of the body. That reference point so that you understand what everyone's talking about. Okay, so just be sure that you're aware of that. So let's advance. So the next part is that the body can be divided into three planes that are perpendicular to one another. The frontal plane or the coronal plane divides the body in front and back halves. So when you look at that, the frontal plane is the center diagram on your sheet. Okay, so if you took me and you took a chainsaw and you put it on top of my head as I'm demonstrating, and I'll come down a little bit, and if you cut all the way down, and the anterior part of my body would fall forwards, and the posterior of my body would fall backwards. The sagittal plane, also known as parasagittal or mid-sagittal, divides the body into left and right halves. So the sagittal plane, as you can see, is on the left of your handout. So if you took that same chainsaw and you cut it down my body, the left side of my body would fall to the left, my right-hand side of my body would fall to the right. The last one is the transverse or horizontal plane, and that divides the body into top and bottom. So if you cut me in half, right across my middle, then the front part, the upper part of my body would be in one piece, and the lower part of my body would be in another piece. Now, that's probably a pretty quick review. So let's see what directions that we're talking about. You really need to get these straight as we go along, as all of the directions along the planes of the body. So let's advance a little more on the handout. So let's discuss that. Direction along the planes of the body. The frontal plane, where you're talking about front, back, anterior, posterior, ventral, dorsal. So people can use those different terminology to talk about the direction of the body: anterior, posterior, front, back, or ventral, dorsal. In the sagittal plane, they talk about different directions as well. The left and the right halves, which would make sense: my left, my right, to your left, to your right. Going to the plane is medial. So going towards the center of the body is medial. Away from the plane is lateral. The next one is transverse or horizontal plane. You have the superior part of your body versus the caudal part towards my feet. Okay? Or cephalo-caudal. Superior, inferior, cephalo-caudal would be towards my feet. Okay, now let's talk about different types of movements, angular and rotational. Angular movements are movements that produce an increase or decrease in the angle between two adjacent bones. So the best example that I could give you would be elbow flexion. So you see a decrease in the angle between the humerus and the radius and the ulna. And extension, angular movements, are movements that produce an increase or decrease in the angle between two adjacent bones. The best example that I could give you is flexion of the body would be bending so that the body parts come closer together So in other words, the humerus, the radius, and the ulna, there would be a decrease in angle and they'd be closer to one another, as you see here. Extension would be the straightening of a part so that the adjacent bone surfaces create a larger angle. It's the opposite of flexion. So then the distance between the humerus, the radius, and the ulna that we just discussed would become greater. The last one is hyperextension. You can see the diagrams on your handout or the pictures on your handout. It's movement that breaks the plane and goes beyond normal anatomical position. If you'll notice the specific picture on the right, you'll see hyperextension of the elbow. You'll see that with hypotonicity, children with Down syndrome or disorders where there's a hypotonic muscle contraction going on throughout the body or parts of the body. The other one that you're going to see a lot of is as you look at the knee on the left-hand side of your sheet, you're going to notice that the knee actually goes backwards into recurvatum, so it is hyperextended. Since I can't do those things, you will see, you'll have to refer to your pictures. Someone in class may actually have it of the elbows. It's not atypical to see it in the typically developing population. But knowing about hyperextension is really important because you need to understand that when you're doing range of motion, if you're positioning someone, that no extremity, no joint should be in a hyperextended posture. It really erodes the joint stability of that joint, and it can be very detrimental to the patient.